All right, so I would recommend all of you favorite this Fidelity Hr Login screen because this will be the easiest path to get in, and it is really good at saving your username and password, so you don't have to keep entering it every time. So basically, when you get a new client, whether it be for the SYT grant or in FRC case, if you have somebody that's both mobile response and SYT, you're going to go in here and see your home screen within the Fidelity system. And so if you see my screen right now, it'll probably look a lot different from yours because I have an administrative account, which gives me access to all of these different county configurations. So I'm guessing each of you probably just have the one configuration name. So what you do to get into your actual kind of configuration is you go over here to the very far side of the screen at this Edit Admin tab. And I'll try and highlight it for you guys so you can follow along a little better. But so it's over here on the far right, and then you just click Go to Configuration. So for this case, since we have a few people from Hancock County here, or maybe I'll use a county that has the fewest amount of potential data in it, so we avoid any PHI breaches. I'll go ahead and click. Let's do Meigs County. So you go ahead and click over here, and that'll bring you into all of your data cases. And so at this point, you'll be able to see all of the cases of data that have been entered into your county. So since in this training, we're basically demonstrating how to add a new client and how to go ahead and conduct their GPRA record, I'm going to go ahead and show you how to create a new ID. I'm not sure if all of you have been through the actual Fidelity training or not. I'll assume that you have, but I'll try and explain a little bit for those of you that may not. So first, you're going to want to go down here to this quick links box and click Add a New Youth Record. So at this point, it'll ask you if you'd like to add a new record using a referral form builder. This was something that they went over a lot in the training, but I don't think we want to do that for this demo. So for the sake of this training, I'm going to click no. So let's go ahead and create a test case for a new user that's going through the SYT program. So we'll go ahead and call them GPRA test. And so we're just going to fill out the minimal amount of data required to continue, just for the sake of time. And so you'll go through and enter all this demographic information just so you can save a record within the system. So we'll say 2001. And so you do need all of this information to actually save a record in here. So keep that in mind when you start this, that you will need to know their address, date of birth, phone number, all of that stuff.
Everything with the red asterisk is required.
Exactly. So once you fill out all of those red asterisks, if you just hit save, looks like I missed one. Go ahead and click save. Oh, and another phone type is required. All right, here's another pre-population to today's date. Looks like you need to adjust this because they want you to enter as much data into the system as possible. So they will usually encourage you to enter more data. So here is your home kind of base for any record that you enter. So for the purposes of this training, all you need to do at this point is to go up here to your dashboard, click on assessments, then this will bring up all of the different assessments that are created within Fidelity HR for your configuration. So there's a bunch of core assessments that you can do that depending on your program, you might want to take advantage of. But for our sake, the GPRA lives here in this custom assessments tab. So when you click on that, it will basically show any of these custom assessments that you've done so far. And since this is a brand new client, we haven't done any yet, you're going to want to click Add Custom Assessments. So this will bring up all of the different possibilities for the GPRA, the Ohio scale, some of the other custom assessments we've built in here. So for all GPRA that you're going to enter, and this is regardless of whether you are SYT grantee or you're an engaged grantee, you're going to click on this GPRA assessment, which is the third one down. And so we actually broke this out into 3 different interviews because we realized we might have some overlap between clients that might be receiving the SYT substance abuse treatment and that are also receiving the mobile crisis response. So we wanted to make it as inclusive as possible that you wouldn't have to re-enter data should that happen.
That actually is Jonna's
Hang on, I need to mute somebody.
Yeah.
Yeah, we're
So,
all right. Actually, they told me about this earlier.
yeah,
All
she
right.
called in earlier, the mom did.
All right, there we go. So this is basically your demographic section of the GPRA because that's not going to change regardless of which version of the GPRA you're doing, whether you're doing the one required for Engage or whether you're doing the one required for SYT. So you're going to need a consumer ID number. The federal system that we report to requires you to basically de-identify all of the data. So for that reason, we've asked you guys to give kind of a unique ID for your clients. And I think all of you have been doing that so far for any of the GPRA forms that you've sent me. And that can be whatever you use at your local provider, as maybe like an identification number that you guys use, or it can be any kind of numeric code. So in this case, we'll just go ahead and say this is client 1. So we'll say like 0001. This contract grant ID is something that we'll have to fill in on our end. So you can just go ahead and leave that blank. Then for the interview assessment type, since we're doing a intake right now for this demonstration, we'll go ahead and click intake. We'll go ahead and enter today's date for the date completed. And then we'll start going through some of the demographic info. And I already forgot what I put in the actual record, so I think I put female. So you'll basically just go through here and fill out any of the demographic info that we have. I know this doesn't look quite as neat as you might want it to look, but the programming that they did, they had to list it like this for a certain reason, where rather than having like a label above the certain titles, they actually had to do code numbers, and that's for, I don't know, the data management output side of this. So at the beginning of each question, they will list out which number corresponds with which response. So in this case, it's 1 is a yes, 2 is a no, and then -7 refused, -1 not applicable. So since we selected no for Hispanic or Latino, we'll go ahead and leave all of those as a 2. And so you'll see that actually populates this TS column over here as a 0, because when we do pull this data out, it basically builds a giant spreadsheet with all of these different columns. And so you need actual values in those columns. It won't read blank columns. So there's a lot of that kind of stuff in here you'll notice. So what race do you consider yourself? You'll go through this list again and again. 1 is yes, 2 is no. And I think I said white on our record, so go ahead and select 1 for that, and then 2 for all the others. And then I already forgot what I put for my date of birth, but we'll put something else in there. And so this next question is asking what is your year of birth, and I'm not sure why they have it broken out like this, but you might need to fill these out as probably another reason why when they build the data at the end, it needs these certain fields filled in. So then we get to the next question, which is military and family deployment. And again, all of these questions are asked in both versions of the GPRA, so you'll only have to do these once. So we'll say, no, they were not ever served in the armed forces, reserves, or National Guard. Was anyone in their family or someone close to you? We'll go ahead and say, yes, one person, just so we can kind of go through this a little bit better. In the past 30 days, how many nights have you or has your child? And then again, they have it broke out here with a 1 equals 1, 2 equals 2, 3 equals 3, 4 equals 4. And I'm guessing they can't do values up to 30 because they broke this down into an 11 equals more than 10 days. So any days that are more than 10, you'll have to select 11 for that. And again, I know this isn't the most user friendly, but we'll have to do with what we can. So it actually looks like they might have missed something in here because they should have a 0 option for the past 30 days. How many nights have you been? So I will have to make note of that and tell them to make sure we get a 0 option in here. But for the sake of this training, let's go ahead and say that they were homeless 1 day a week. We can also say they don't know with this -8 response. So we'll say don't know for these.
This is something we hadn't caught, so maybe we should
Yeah,
say
I
don't know if it's 0 because we're going to have this fixed.
Right. I'm surprised they didn't put a 0 response in here. I think that was definitely an error on their part. So I'll make sure to talk to Amanda about that. Okay, so moving on. In the past 30 days, where have you been living or has your child been living the most times? And again, the GPRA basically tells you to not read the response options. So anytime you see these extra kind of prompts on here with the questions, make sure to follow those instructions. And if it's in parentheses, don't read it out loud because you're probably going to get a weird look from your client when you ask them, do not read response options to the consumer. So we'll go ahead and say that they are living in a caregiver's owned or rented house. And then if there is another housing option that they don't have listed here, they give you a little box to specify. Okay, then moving on to the education, employment, and income. Here is a list of the highest level of education that they finished. So just go through this, and then and this is again which one they finished. So if they're in, say they're in currently in 11th grade, you would put 10th grade because they haven't actually finished 11th grade yet. So, and then crime and criminal justice status. And so this asks in the past 30 days, how many times have they been arrested? And so again, you can put any numbers in here, 0 to 30, and then if they refuse to answer, it needs you to enter a -7, or if they say they don't know, it needs to be a -8. So again, try and read these as kind of closely as possible, and once you get used to them, it'll be kind of second nature, but for the first few times you go through this, you'll really need to kind of focus on some of the instructions that they have listed here. So we'll say they've been arrested once in the last 30 days. And then here's a few more questions about mental health and physical health. So how would you rate your overall health right now? You can go ahead and say either excellent, very good, good, fair, poor, or refused or don't know. So we'll say good. And then here's another similar question that it looks like they left out the 0 response for. So we'll need to have them fix that again. But so for any amount of days that they got inpatient treatment for a physical complaint, you'll go ahead and select that number. So maybe they did 2 days for that, 2 days for inpatient substance abuse. Maybe they did 7 days of outpatient last month, and then we can say don't know for the emergency room if we don't know that. So then, do you have enough energy for everyday life? Say moderately. How satisfied are you with your ability to perform daily activities? Say very satisfied. And then this next question, it says, on what date did the consumer last receive services? So this is only reported at reassessment or discharge, unless this is basically the last interview they agreed to. So you'll ignore this on the intake. And then I believe the rest of these are all reassessment and discharge questions. So unless this is their 6-month reassessment or their discharge interview, you're just going to skip these last sections. And I might make them add a little section, a little note here that reminds you guys that, so it's a little more clear. All right, so once you go through all of that, you can go ahead and click Save. And then that'll say, it says Assessment Saved Successfully. So you can then review everything that you've done to make sure you didn't make any mistakes. And then if you need a signature, if you have like a supervisor that needs to sign off on this, you can go ahead and show them, okay, well, I've done this interview here, go ahead and click Save Signature. Then it says Signature Saved Successfully. Click OK. And then you can go ahead and click Close for that first part of the new interview. Then you can also create a contact or a service note to attach this assessment to, and that might be something like an instruction for the next interview, or something that might be particularly helpful to yourself the next time you interview this person or someone else that might be interviewing them. So we'll go ahead and say no for this case, and that'll take you back to this main custom core assessment box. And so now when you click back on these custom assessments, that first GPRA, that kind of base foundational GPRA, is now listed here as done. So you're basically halfway there after this point. So I'll go ahead and ask, does anybody have any questions regarding anything I've shown so far? I think I unmuted everybody. And as long as everyone's good with that so far, I'll go ahead and show you guys how to do the second part. And now this part depends on whether you're entering for the SYT or the Engage grant. So you'll go ahead and click Add Again. And so for SYT, we have what's called the CSAT GPRA, which is the SAMHSA Center for Substance Abuse Treatment assessment. So for any grantees that need to do that assessment, go ahead and click that. And so now this takes you to that section that is basically questions that are unique to that tool. So you'll go through this, and I think many of you probably already have, since I've gotten a few GPRAs from some of you. Just go ahead and enter those in. And also, I think I got an email from somebody asking if they should start entering an infidelity, or if they should fax any completed ones to me. And I said, go ahead and enter them in Fidelity. And I think it'd be really helpful for you to maybe start by collecting it on paper, and then transferring what you collected on paper into Fidelity at least the first couple times until you're comfortable with it. And then hopefully you'll get the hang of it by then, and you can kind of sit and do this while you're with the client, and then you won't have to go back and do any kind of duplicate data entry or anything. So we'll go through and fill out the rest of this form. And again, if any of you guys have any questions on any of these questions, or what you need to do as your grant, because a lot of these are basically standardized instruments that SAMHSA requires for a ton of different grants. And so our grant in particular is a substance abuse treatment grant. So a lot of these questions don't apply to that grant. So you will need to read these instructions very carefully to know which ones you don't need to fill out. And again, I don't believe any of these are have the validation where it requires a response. So you can always leave something blank, and then if you realize you may actually have the answer for that, you can go back later and edit. So I would always recommend doing that too. So we'll go through and say, was the client screened by your program for co-occurring mental health and substance use disorders? And for the majority of our SYT clients, that will be a yes. And then did the client screen positive for co-occurring mental health and substance abuse? We'll go ahead and say yes. So this next section has the instruction that is only for SBIRT grants. So for our sake, we're going to skip this entire section because we are not an SBIRT grant. And again, when the system downloads all this data at the end, it needs like blank spaces in the spreadsheet file. So that's why that section shows up, even though it's not applicable to us. I asked them if they could hide it, but I don't think they were able to hide it in this. So just make sure you skip these expert questions every time. And so this next section is asking you basically about what services you're planning with your client. And again, this is kind of a comprehensive assessment that all SAMHSA grants fill out. So a lot of these aren't applicable to us. So just go ahead and click no for anything that you're not planning on serving or providing. And as best as you can, try and figure out what your client is getting, whether that's from you or whether that's from another provider agency, because I think SAMHSA wants to know kind of the full breadth of the services that everyone's getting, even if it isn't just from our grant. So we'll go ahead and say, yes, they're getting case management. No, they're not getting day treatment. No, they're not getting inpatient. Yes, they are getting outpatient. Yes, they are getting outreach. And then we can kind of go through here and click no for the rest just for time's sake. But I think you really want to spend some time on these sections because that'll give us basically the best and most accurate picture of what kind of service array our clients are actually getting. So again, we'll say yes for screening and yes for brief intervention, yes for treatment. And then we can go ahead and say no for some of these. And I'm guessing since most of you are doing ICT, some people have been listing that as another treatment because ICT doesn't actually show up in here. I think the closest thing is this co-occurring treatment and recovery services. But if you want to specify so we can kind of make sure SAMHSA knows that everyone's getting this specific evidence-based practice, I think that's helpful.
I think it could also be individual and family counseling as well.
Mm-hmm. And so that
those are all components.
So that actually brings up a good point that I think we need to kind of stress is that the GPRA should be filled out by basically any client receiving any service as a result of the grant, which could be this integrated co-occurring treatment or also alternative peer groups. It could be motivational interviewing.
Mm-hmm.
So is that the three, Joyce, basically that would trigger a GPRA?
Well, so of course, motivational interviewing is going to be integrated into other things like individual counseling. Mm-hmm. So you just have to click what's most appropriate. Now, back at the top there, Scott, the brief treatment, mm-hmm. that's related to expert. So right. I would say probably, unless you're using the expert process, and I know in Dayton they probably are, you're not probably doing a brief intervention or brief treatment. Because that's part. So expert stands for screening, brief intervention, referral to treatment. Mm-hmm. So I think that's trying to capture the expert services there.
Yeah. So I would say if your agency has been trained in providing expert and then they're doing those services, by all means, click yes on those. Okay. And so again, if you're not sure whether a client is receiving something, it's perfectly fine to leave it blank. Once it eventually loads into the spreadsheet at the end, I think it might auto-populate a response for you. So and here's the case management services. So go through here and anything that's related to case management they might be getting, go ahead and select yes or no. Medical services.
So
again,
and to clarify too, if your clients are getting wraparound services, that's similar to case management type services. So click those things that they're getting within their wraparound.
Right. So I think it's really helpful when you sit down with the client and do this interview. I think it's helpful to maybe ask them at the beginning, okay, so what all are you getting, from our agency? And then if you can get kind of a good picture of what all they're receiving, you can go through this list and kind of pick and choose what best represents what they're getting. And then also going through this list with some of them might trigger something within them and say, oh, I guess I do go see, so-and-so about Social Security benefits or something along those lines. So there's really no one way to do this kind of service section, but I think it does help to go through this list and also just kind of have a conversation with your client about what kind of treatment and what kind of services they're getting. And that'll help you fill this out much quicker too than kind of going through.
So Jen, this is where you would probably check your peer-to-peer recovery support services. You see down there, or aftercare services has recovery coaching.
Right.
Yeah, I see that.
And I don't believe there's anything in here specifying being in a recovery high school either. So that might be something that we just include and we type in another box. I don't know if that'd be under these education services section here or what exactly that would be, but I would imagine SAMHSA would want to know that some of our enrollees are in a substance abuse or recovery high school. So, but again, they have to kind of make these as one size fits all as they can. So
I would probably put that under education. What do you think?
Yeah, I would probably put it under education.
Yeah. All right, well, let's go ahead and get through the rest of this so we can get to the other section. So this moves on to ask about, they do ask one question about the military and family deployment in both versions of the survey, but in the RCSAT SYT version, they get a little more in depth. They want to know, have you ever been deployed to a combat zone? So if you did go ahead and say no for the other ones, you can leave the next few blank. If you have everyone, if a family member or someone close to you on active duty what is the relationship of that person to you? So they want to know if you have any close family relatives that served, and if they served in Iraq or Afghanistan. I'm guessing that was a big policy change in the last few years, is that they want to research kind of how the military service of the last 20 years has affected people. So that's why all those questions are in there. Then they also want to know if they were physically injured during combat. And again, you can click 0 for no. Did they develop combat stress-related symptoms during their deployment? So again, if you selected no for all of these, you can go ahead and leave that blank. Were they killed during duty? Okay, and now on to a little more applicable to our program. This is really important for our outcomes, is the drug and alcohol use section. And so the way they measure this on the CSAT GPRA is they ask during the past 30 days, how many days during that month did they use? So certain different things like alcohol, how many days did they drink alcohol to intoxication? And for males, that's 5 drinks in one sitting. For females, it's 4. And then they ask about illegal drug use, and then they ask about how many days were simultaneous alcohol and drug use. So for the sake of this record, we'll put they drank 5 days in the past month. We'll say they had, since this was, I think, a female client, we'll say that they had 3 days of drinking to intoxication. They used illegal drugs 7 times, and they did simultaneous alcohol and drug use on 2 days. So then they go through and ask specifically which drug and which route of administration they used. So during the past 30 days, how many days have you used crack or cocaine? Go ahead and say 0. And if we'll say marijuana, I think I put 7 days for illegal drugs up here. So let's say marijuana was their drug of choice, that they used each of those 7 days. Then if you do select a number here, you have to select what was the route of administration. So could be in smoking, we'll select that. Opiates, we'll go ahead and say 0. Then they go through basically a whole laundry list of substances, and they get very specific in here. So you can go through, and once you get good at doing this. You can kind of ask these questions, and if they say, okay, I used marijuana once in the last 7 days, go ahead and fill that out, and then you can kind of just click as quick as you can down through here. And again, I know this isn't the most user-friendly way to fill out these questions, but I think they have their reasons for why it's kind of listed like this. And then it asks about injecting drugs in the last 30 days, so go ahead and say no for that if that's the case. And then in the past 30 days, how often did you use a syringe, needle, cooker, cotton, or anything else? And since we said no, say never. Then family and living conditions. How satisfied are you with the conditions of your living space? That's kind of a new question that they just added recently. During the past 30 days, how stressful has this been for you because of your alcohol or drug use? We'll say not at all for these questions. They basically want to know what effect their alcohol or drug use, or what effect they feel their alcohol or drug use had on their mental health and different living and functioning type outcomes. So during the past 30 days, has your alcohol or drug use caused you to have emotional problems? Okay, then moving down, are you currently pregnant? Obviously, if this is a male, you're going to select no here. Do you have children? Yes or no. Then they ask how many children you have. So maybe they have one children, and that children was taken away through a protection order. Go ahead and say yes. And then say yes, they had that one child that was taken away. For how many of your children have you lost parental rights? Since they had one taken, that might be the case. So we'll go ahead and put one there. Moving on to education and employment. Are you currently enrolled in school or a job training program? So this is what they want to know, if they're enrolled either full-time, part-time, or not enrolled at all. And again, in that kind of base foundational interview, they asked more specifically about the grades, but here it's just kind of they want to know more about whether they're in like a post-secondary enrollment program, or if you're in college or something along those lines. And then they ask more in depth about employment. And so they have it broken down into whether they're employed full-time, whether they're employed part-time, and then they have a whole bunch of different sections and categories for unemployed. So you'll want to follow up if they say they're not working and say, okay, are you unemployed because you're disabled? Are you just not looking for work? Are you doing volunteer work? Or are you actively looking? Because they really want to know specifically why people aren't in the workforce. So then there's a section here on their personal income. So for here, you're just going to ask basically how much money they earned if they have a job from wages. So say they earned maybe $150 in the last month. Public assistance, they get $150. They get no retirement, no disability, any non-legal income. So I would usually ask about this question is there's probably some of our cases where people are getting their income from non-legal means. And so they just want to get an accurate picture of what kind of living situation our clients find themselves in. And then if there's any other income, specify. And then it asks if they have enough money to meet their needs. And so depending on, I don't know, the age of our clients, this question might be maybe a little more applicable to some of the older ones and some of the younger ones. So that would really help determine how these questions above on the actual amount of money that they make, how that actually affects their life. So then finally, they want to know a little bit more about the criminal justice status. In the past 30 days, how many times have you been arrested for a drug-related offense? So maybe they've been arrested once, and that's why they found themselves getting treatment. So go ahead and put one there. In the past 30 days, how many nights have you spent in jail or prison? Maybe they did one. And then in the past 30 days, how many times have you committed a crime? And so basically how many times they said they use an illegal drug above, you should follow suit with that and add that same number here, because maybe they don't view it as committing a crime, but SAMHSA requires, if you put in their federal portal, if you put that they maybe smoked marijuana 7 times in the last month, they will not let you move forward with this next question until you meet or exceed that same number, because
And
smoking
also
marijuana
notice
is
in
a
the
crime.
parentheses, if they're refusing, you still have to enter a number, so it's -7. Or if the respondent
Right.
doesn't know, it's -8.
Mhm. All right, and then we're almost done here. Are you currently awaiting charges, trial, or sentencing? And are you currently on parole or probation? So we'll say yes for that. So then they do ask some more sensitive questions about sexual activity during the past 30 days. Did you engage in sexual activity? I'm guessing you'll probably get a lot of refusals here. So if that's what they say, go ahead and click that. And then it asks for specific number of contacts. And again, since this is a very comprehensive substance abuse kind of wide, SAMHSA-wide assessment, they do have a lot of research out there about basically like intravenous drug use and kind of the effect that has on the public health. So that's why all these questions are here, even though they may not seem too applicable to our program, but SAMHSA requires them for all programs. So, and then it asks about HIV testing. Do you know the results of your HIV testing? How would you rate your quality of life? How satisfied are you with your health? How satisfied are you with yourself? And then they ask an open-ended, in the past 30 days, and this is not due to your use of alcohol or drugs, how many days have you experienced serious depression? So again, you'll want to enter between 0 and 30 for here, and kind of you might need to prompt your client a little bit on whether or not, they might say like weekly, they might say, fairly often. So just try and prompt them to give you an amount of days. So if they say like maybe half the time, you would say, okay, so like 15 days, that's half of the month. So you'll kind of have to get used to asking these questions and getting the responses that they need in here with the number of days. So experience anxiety or tension, experience hallucinations, trouble understanding, concentrating, or remembering, experience trouble controlling violent behavior. Then there's a question about suicide attempts. And then how many times have they been prescribed medication for a psych or emotional problem? And how many times? And so this question, I always get out because the way they ask it is very unclear. And so it asks been prescribed medication for a psych or emotional problem. And so the way that it's worded, it makes it sound like if you had been prescribed for the first time, you would say once, but some people would think to answer, oh, I take something every day. So the response you want to give is whether or not they got a new prescription is I think the way SAMHSA has instructed us to ask this question. And so how much have you been bothered by these psychological or emotional problems? Say considerably. And then they give the brief trauma screen, which is, have you ever experienced violence or trauma in any setting? And so this, I would recommend reading this entire question, because a lot of times, once you kind of get down into some of these, such like neglect or traumatic grief, like maybe they lost a friend in the last, week or so, or in the last few months, they may not think of that as experiencing violence or trauma, but when you kind of present it like that to them, they'll say, oh yeah, I guess I did experience some trauma. So go ahead and click yes for that. And then they ask the 4 follow-up questions on the trauma screen, which is having nightmares or thought about that trauma, trying hard not to think about it or avoid situations, feeling constantly on guard, watchful, or easily startled, feeling numb and detached from others. And then they ask about physical violence. So in the past 30 days, how often have you been hit, kicked, slapped, or otherwise physically hurt? And then the last line of section here is about their social connectedness and basically attending self-help groups or like Alcoholics Anonymous, not Narcotics Anonymous. So it asks about these are voluntary groups that were not affiliated with a religious or faith-based organization. And then it says how many times, if they did. In the past 30 days, did you attend any religious affiliate or faith-affiliated recovery groups? Say no, 0. And in the past 30 days, did you attend meetings that support recovery other than the organizations described above? And then did you have any interaction with family or friends that are supportive of your recovery? And then who do they typically turn to when they're having trouble? And then the last question is, how satisfied are you with your personal relationships? All right. So again, that's it for the intake interviews. And then once you see here, it says follow-up status. This section is for follow-up interviews only. So when you conduct a follow-up, you'll continue going along with this. But at the intake, you can just go ahead and click save. And then it'll show you a review of all of what you've just done and say assessment saved successfully. And then you can click save and close. And if you want to, and again, it asks you if you want to create a new service note or contact note, we'll say no for this case. It's not wanting to let me continue. There we go. Okay, so now if you click back to here, you should see your GPRA assessment completed here, and I wonder if that didn't go through for a certain reason, because it should be listed right here under the GPRA assessment as the completed. It should list a CSAT assessment, so I'm thinking there was probably an error somewhere in there, which hopefully will not happen for you guys, but we'll have to get with Fidelity and hopefully figure out if that's a possibility that can happen and worry about it debugging and get that fixed.
That might be why it didn't let you save, because there was something missing.
Yeah.
This is another good reason to have you do a paper tool, because we're still working some bugs out of this electronic assessment. I saw some misspellings. You probably all saw those as well. So there's some things we've got to work out.
Okay, it looks like it did actually save it here. So, but again, if you ever run into anything like that, you feel free to contact me, and then we can pass along. Because the good thing about having all of this data kind of written into a cloud is usually they can access it from their server if something goes wrong at the local level. And so you shouldn't have to go through and re-enter all your data. But again, like Joyce said, if you feel more comfortable doing it on paper and pencil first, I think that's probably a good way to do it, at least for the first few months of getting used to this and working through the kinks of a new system. And it looks like we've got a lot of stuff to take back to Fidelity, and we can hopefully work this out to make it as user-friendly as possible, because right now I think there's definitely some things that I see that we can hopefully get them to fix and make better for all of us. But at that point, that's basically it for entering your SYT GPRA interview. I know there was a couple attendees that are in both the Engage and SYT grants. So just to quickly show you what you would do is you would click on the CMHS assessment, which is basically the mental health side of SAMHSA's version of the GPRA, and then that'll give you all the different questions that are limited to just that survey. And fortunately for them, there are a lot fewer than there are for the substance abuse.
So just to go back and kind of make sure you all get this. So there's a core assessment that is called GPRA, and everybody has to do that, whether you're doing the mental health side second piece or the substance use side second piece. So the first piece for everyone is the GPRA.
Correct.
And then, so if you're a YTI grantee and you have a young person in substance use disorder services, you'll do the CSAT assessment. If they also receive mobile response, you're going to do the CMHS assessment as well. But you're not going to have, the reason that's broken out this way is that GPRA assessment is core pieces that are to both the substance use side as well as the mental health side. You won't have to repeat. That's why it's broken out into 3 assessments. I don't know if that helped clear it up, why we're doing it this way, but you can ask questions if it didn't.
Yeah, so I know it looks like a couple people left, and I'm sorry, this is not the most entertaining thing to go through. But is there any questions that anyone has right now that we can answer? If not, we'll go ahead and cut the recording, and I'm available to answer any questions you have when you work through this. Let me put my contact information up here. If you have any questions related to the actual GPRA tool. And then again, if you need help getting access to Fidelity or are having difficulties logging in, you can contact Chad. So I will go ahead and leave this up for a few seconds, and I'll go ahead and stop recording for everyone else. And thanks for attending.